I'd like to introduce Dr. Felipe Jain, who is a psychiatrist at Mass General, Director of Healthy Aging Studies at the Depression Clinical and Research Program, and the Assistant Professor of Psychiatry at Harvard Medical School. Dr. Jain graduated from Brown University with a bachelor's in neuroscience and from Harvard Medical School and the Harvard-MIT Division of Health Sciences and Technology with honors in 2008. He pursued psychiatry residency training and postdoc fellowship at the University of California, Los Angeles. I like this, which he describes as a, quote, 7-year vacation from Boston. Who wants a vacation from Boston? Don't you love our traffic? His research focus, which is really lovely to hear about, on guided imagery and mindfulness practices for the treatment of depression and anxiety and neuroimaging biomarkers has been used to personalize treatment for individuals. He has received, and this is all we'll hear about, he has received research funding from the National Institutes of Health and private foundations to develop a new guided imagery and mindfulness treatment approach called mentalizing imagery therapy. It seeks to encourage perspective taking and other relationship skills in addition to promoting increased well-being and reducing symptoms of depression and anxiety.
I'm delighted to talk with you this evening about caregivers, caregiving, guided imagery approaches that caregivers can use. And so I thought I would start with a slide of people to whom I'm grateful. And these are some caregivers of family members with dementia who participated in some of the early research studies that we did at the University of California, Los Angeles. And they gave everything that they had to the program, to their participation, and it's because of them and other caregivers like them that I have the results that I want to share with you tonight. So let's start off just by thinking about what is a caregiver, and this became a kind of a funny conundrum recently because a neurologist that I collaborate with, Dr. Ramirez Gomez, was on a Spanish language radio program because we're trying to bring this work also to Spanish language caregivers. And the radio host asked her, what is a caregiver? Because within the Hispanic population, you don't have that kind of a defined role if you're a family member. You're the daughter, you're the husband, you're the wife, you're the son, but not necessarily a caregiver in the same way. And I think that speaks to the ways in which our roles merge and change over the course of a lifetime. And each of us who are patients may at some point be caregivers, and each of us who are caregivers may at some point be patients once again. When we always automatically care for our loved ones in relationships and do things for them, and they in turn do things for us. And unfortunately, when our loved one is suffering from a chronic and disabling illness, much of the caring goes in one direction, and the relationship becomes more asymmetrical, which can be very challenging and extremely stressful for the caregiver. So what we know about caregivers and caregiving is that caregivers have higher rates of depression and anxiety over the course of the years in which they may be caregiving a loved one with dementia. They may have as much as a 40 to 50% risk of succumbing to a major depressive episode. We know that their immune system function declines. So caregivers who receive a flu vaccine don't mount as much of a substantial immune response as age-matched non-caregivers. And very interestingly, some studies have looked at the particular role of psychological stress or strain and how that relates to caregiver outcomes. And what they found was that caregivers who reported strain, that the burdens of caregiving were becoming too much for them, that they were physically challenged, that their sleep was impaired, that they had a 63% higher incidence of all-cause mortality in the ensuing years than did age-matched controls. But I think hopefully for caregivers, those who did not report psychological stress and strain did not share this risk. So there's something toxic, not about the label of being a caregiver, but about how that stress gets into the body. And some of the data that I'm going to present to you tonight is some of the first time that caregivers have been neuroimaged, that we've looked at their brain function circuits to see how might that stress of caregiving translate into the body, and what brain circuits may be affected as caregiver symptoms start to improve. Caregiver stress, let's talk about those. So there are many ways. Some are external. Caregivers really need education about what dementia is, what different phases and stages their loved ones may go through. They need skills training for dealing with a loved one who may exhibit behaviors that are abnormal or unusual, that they may have trouble understanding, or to bear some of the physical load of helping their loved ones with basic tasks. Respite care is often very helpful and involves caregivers being able to take breaks from their caregiving responsibilities for a few hours, sometimes for a few days. In-home services can be essential to evaluate the safety of the home environment and to make sure that the caregiver and care recipient interaction is going well. And finally, psychological options, which we'll be talking about. So most classically, people have studied cognitive behavioral therapy, which involves remedying cognitive distortions related to caregiving. So some caregivers find themselves catastrophizing a lot, and they have very negative thoughts about the future that they may consider to not be the most likely outcome, but that nevertheless cause them tremendous stress, and cognitive behavioral therapy can be very helpful for that. Mindfulness therapies are growing in interest in their research base, and we'll talk more about them. Guided imagery approaches and other self-care practices. Since our topic tonight is guided imagery, let's talk about what imagery actually is. So, what are the components of a mental image? And this is broader than you might think. So imagery, we normally think about what we can imagine visually with our mind. But have you ever noticed yourself replaying an interaction with another person in your head? And you might remember what they said to you. You might remember how that felt to you. These are all forms of mental images. They're all representations of the external world that our mind creates. And so all of our senses can be involved in creating mental images. Sight, smell, hearing, touch, taste. All of these things you can fictively imagine and recreate. And sometimes these images can be tremendously powerful. An image can come back to, quote, haunt you, or an image of a pleasurable or pleasant event can come back to you and remind you of something wonderful that happened and really make you feel good. And it's the whole sensory experience of it that's really important in that process. in guided imagery exercises, we're gaining perspective and control over our internal images so that they don't upset us quite as much. That can be one use of it. Another use can be generating positive images that help us soothe ourselves. And this is the more traditional kind of guided imagery that you may be familiar with. For example, a person leading another person to imagine themselves on a beach and the sound of the waves, the sound of the ocean, the scent of the salt in the water. Now, some guided imagery practices have been studied for caregivers, and I'd like to say that there's overlap between guided imagery practices, meditative practices, and mindfulness types of practices. So